Good morning.
Good morning. Please have a seat. What can I help you?
Yes, I want to check on my pregnancy.
It's your first time to check on your pregnancy, isn't it?
Yeah, it is.
Okay, ma'am. Let me introduce myself first. I'm midwife Anna. I help you to check on your pregnancy. May I know your name?
Sure, I'm Lizzie.
When did you find out that you were pregnant?
It's around last week. I took a pregnancy test using a test pack and it said positive. And also I'm 3 weeks late for my period.
Do you remember the first day of your last period?
Yes, I do. It's 6th of February 2022.
Okay, if we calculate from the first day of your last period, and this time your gestational age is around 6 weeks. How do you feel right now?
I feel good, but sometimes, ma'am, I get nauseous.
What kind of nauseous do you feel? When did the nurse appear?
I always got nauseous when I was about to eat. Therefore, lately I rarely eat.
Okay, ma'am, are you feeling nauseous now?
At this time, no, I'm not. I feel good.
Well then, if you don't mind, I'll ask you about a few things. How old are you and when is your date of birth?
I'm 22 years old and my date of birth is 2nd of January 2000.
Where is your address and with whom do you live?
I live at 2A Mauer Street with my husband.
What is your husband's name and how old is he?
His name is Andy and he's 24 years old.
It is your first pregnancy?
Yes, ma'am, it's my first pregnancy.
Have you ever suffered from, are you currently suffering from certain diseases, such as shortness of breath, hypertension, diabetes, and other diseases?
No, I'm not.
Do you have any allergies to anything?
No, I don't.
What is your occupation?
For now, I don't have a job, so yeah, I have enough time to rest.
Then, how are your daily activities?
I only do some household chores, such as sweeping or washing clothes, but my husband and I work together for this.
Okay, because sometimes you get nauseous, then how is your diet? How many times you eat and drinks in a day?
I try to eat 3 times a day, but because of the nausea, I couldn't enjoy that food.
Okay, ma'am, we will talk about the nurse after I do a check your pregnancy, so I don't on this bed.
Okay, ma'am.
Okay, your pregnancy is a good condition. However, I recommend to do a pregnancy ultrasound at the obstetrician to know the condition of the fetus. Because at this gestational age, midwife can only check the mother's condition. Do you want me to schedule an ultrasound with the obstetrician?
Yes, please, ma'am.
Okay, you have an appointment with Dr. Aisha to do an ultrasound on Thursday at p.m.
On Thursday at 8. Okay, ma'am. Thank you.
Now, let's talk about the nurse. During early pregnancy at 1 to 3 months out, most of pregnancy women would get nauseous. It's a natural thing. To overcome this problem, you can drink ginger or lime water made from a glass of water and 2 taps or ginger or lime juice. When you're about to eat, you could eat any kind of mint candy. It will reduce the nausea. You could eat in small portion but often. Do not let your body lack of nutrition for you and your baby.
Okay. Thank you for the information, midwife. But are there any food and drink restrictions for me, for pregnant women?
There are some food and drinks the mother should avoid, such as raw food, burnt food, and alcoholic beverage. Basically, you can eat whatever you want beside the food and drinks I mentioned earlier.
Okay, thank you so much, ma'am, for all the information.
problems. I will give you some vitamin which can be redeemed at the pharmacy.
Okay. Thank you, ma'am. Good morning.
Morning.